Hey guys, how are you? This is Dr. Frederick Brown out here in Houston, Texas, and it's Christmas night, so we have to first start by saying, God bless you, Merry Christmas. What a great holiday. Thank you, God, for giving us Jesus. We're appreciative. Um, Anyways, let's talk a little bit about this question that we received over at Clinical Notebook tonight. And the basic question is someone called in and asked, should they take Januvia? Januvia is a medication for type 2 diabetes, and apparently there's a little bit of controversy. They wanted to know, is that something they should take? So let's get right to it. It depends. Obviously, it depends on a couple things. First of all, you got to understand what type 2 diabetes is. Remember, at the essence of type 2 diabetes is insulin resistance. When the insulin receptors in your body become resistant to insulin, you get elevated sugars and you develop diabetes. Okay, so remember that insulin is a hormone, it functions like a key. There are insulin receptors, so every key has a keyhole. Both sides of the equation have to work. So when you get insulin resistance, i.e., when the keyhole is resistant to insulin, that's when things go wrong. Remember that insulin takes sugar from the blood and drives it into the cell. When that mechanism doesn't work, sugars rise, hence you get diabetes. It's very important to understand that. Unfortunately, what so many people don't realize, including a lot of clinicians, is that type 2 diabetes is based upon and started by insulin resistance. And unfortunately, too often in medicine, we use the wrong interventions. In my opinion, the best way to treat diabetes is to first start by decreasing insulin resistance. How do you do that? Exercise, diet, and as a integrative physician, I use a lot of natural vitamins and so forth, which measurably and predictably and repeatedly reduce insulin resistance. Um, Another key point is you got to get to a doctor that will test your insulin resistance. If we're looking at sugars and hemoglobin A1Cs, that doesn't really allow the clinician to understand what is driving the disease. You need to have an understanding of, is there insulin resistance on board? What extent of insulin resistance is present, and how advanced is each person in the disease process. So if you're a newbie and you're just starting to develop some insulin resistance, you may be 2, 4, 6, 8, 10 years outside of ever becoming a diabetic. In other words, you catch it way ahead of the curve. Other people are right on the cusp of either being pre-diabetic or even a diabetic. So you got to have a good understanding of where your personal health is, how well you are controlled. If your hemoglobin A1C is 9 and you want to stop Januvia, good luck. It's going to be tough. In other words, if your disease is advanced, it's going to be a tough call. If you're kind of right on the border, your hemoglobin A1C is 6 or 7, and you've got a mild case of diabetes, there's things that you can do with diet, lifestyle, and vitamins that will reduce your insulin resistance, reduce the amount of insulin that your body makes. Hence, it takes you out of what we call a hyperinsulinemic state, and helps mitigate the disease that way. So the other part is that you got to understand what Januvia does. It increases, at the end of the day, it ends up increasing the amount of insulin that is created by the beta cells in your pancreas. Your body does that naturally. At the same time that, just while you want your clinician to be measuring insulin resistance, they should also be measuring insulin. In other words, the more insulin resistance you have, the higher levels of insulin that your body is already making endogenously on its own as a response to the insulin resistance. In my opinion, it's my clinical practice. If someone is not advanced in the disease, I want to cut the insulin resistance because that will naturally cut the amount of insulin that you're making. Why in the world put you on something that's just going to make yet more insulin? Doesn't make sense, because your body's already making more insulin. then you add even yet more insulin to the equation, and you're further wearing out the beta cells of your pancreas that are responsible for making insulin. Whereas if you just cut the insulin resistance, naturally cut the level of endogenously produced insulin, um, and do some other lifestyle measures to keep your sugars down, we can get a lot better response. So at the end of the day, like I said, my understanding is that there is a question on Clinical Notebook about whether or not you can get off of Januvia. It depends on how advanced your disease is. It depends on how much insulin resistance you have. It depends on, what stage in the disease process are you in, how well it's controlled and so forth. So also remember that another good option is glucophage or metformin. I'm sure you guys probably had that discussion by now, but metformin works by a few different mechanisms, one of which is really decreasing the insulin resistance. So it really depends on your philosophy. Do you want to use medicinal versus non-medicinal treatment? Do you want or need to use a combination, which is very common as well? So at the end of the day, you're going to have to get with your doctor, your clinician, and kind of have that discussion. It'd probably be a pretty worthwhile question asking. But at the end of the day, you also want to make sure that you get with someone that understands insulin resistance, hyperinsulinemic state, and understanding where the disease process is um, in order to best treat the disease. So um, that's kind of the basics. I hope that you understand it, and I hope that if you don't, you can feel free to post another question and we can clarify some things. So thank you, and have a great night. God bless.